Assalamu alaikum wa rahmatullahi wa barakatuh. This is our fourth recording. We had three previous recordings in which we discussed in the first recording history taking and management planning for MRCPCH clinical exam. And in the second recording we discussed communication station scenarios and we took example consent taking. In the third recording we discussed how to prepare for the clinical exam, and that was based on the request of many colleagues, and I hope they get benefit of this recording. And in this recording we are going to resume back our communication station scenarios, and in this recording we are going to discuss education and information giving. Both are close to each other, but the difference that the role player in education, he will represent colleague or medical student or junior medical staff, and in information giving you are going to speak to most likely mother or patient himself. So the approach, we will start the first two steps as we used before. The first step is going to be greeting of the role player, and the second step is introduction of yourself. Good morning, I am Dr. Ahmed, pediatric registrar, one of the team who's taking care of your kid. This is regarding the information giving. And then you will ask for the background of the case, and that will be like an entry for the scenario, house, and you mention the name of the patient or the son of the kid. So how's Mahmoud, for example? Okay, and you are expecting that mother is going to give you brief history about the complaint or what's going on. So there are many topics very common in information giving, and usually they are linked to your awareness about NICE guidelines. Most of them are outpatient advices, okay, and they will include some instructions, some advices, and the background actually you have to check first, and then based on that you are going to build new knowledge or new information to the mother, and based on her background and the knowledge you built, you are going to direct her to some sources to help her improve the quality of care based on her knowledge, and after that you can also supply her with some leaflets and some referring doctors. So, and you can also help her by asking if she want to have any help. She can refer back to you through your contact numbers or through hospital itself. So this in brief. We can discuss the topics which are related to information giving. So in NICE guidelines there are some topics we have to focus on, especially in case that we are expecting information giving to be one of the scenarios in our exam. So these topics, we can mention some of them: allergy, eczema, okay, asthma. So all these topics are linked to each other, and you will find guidelines for food allergy in NICE guidelines. You will find some guidelines regarding eczema, okay, and you will have our Scotch guidelines for management of asthma, which are linked to NICE guidelines. So you have to study them very well, okay, and you have to be aware about the advices and precautions you have to tell the mother and to instruct the mother about. What else? We have other topics like constipation, for example, very common, functional constipation. Also diarrhea, management of diarrhea. Also we have some topics like celiac disease, okay, inflammatory bowel disease. Okay. So these topics, I think they are good material for information giving station. What I'm expecting to do, I have to first, as I mentioned, to check the background of the mother, what she knows about the what's going on. Does she understand why it happens? Okay, so why baby is having functional constipation, why baby is having food allergy, what is her understanding to allergy, how allergy happens, what's her understanding for asthma. Okay, so I have to check this first, and based on her knowledge I have to encourage her, and I have to actually based on her knowledge, as I mentioned, to build up my new informations. Okay, so let's say, give example for a mother. She brought her son, Mahmoud, who had eaten a certain type of candies in the school, and when he returned back home, mother notes that he's having swollen lips, skin rash all over the body, and he started to have difficulty of breathing. She brought him directly to the ER, where he received a medication. Okay, they told her that he received adrenaline, okay, IM, and he remained there in ER for a few hours for observation. And you are supposed to talk to her before she's going to be discharged about the management plan. I think this is a common scenario. I myself had been examined this scenario, okay? So if we are going to think together about this story, okay? So first, as we mentioned, the first two steps, you are going to greet her, and then you are going to introduce yourself, as we mentioned, and then you are going to check her background. So can you tell me what's going on with Mahmoud, or how is he, what happened to Mahmoud? And then she will say a brief history, just as we mentioned, okay? So, and then you are going to build up your knowledge, or her knowledge, based on that history. So you can make it a little bit interactive. You can ask her, so do you have any idea why that happened? Then she's expected to say, maybe I think he's having allergy. I think most of people knows about allergy, but they don't know how it happens. Okay. So in this way, you are expected to start to tell her about that our body is sensitive to certain substances, and how the body is sensitive. Expected that the body is going to release certain substance in our body which cause these reactions in the form of swelling of the lips because of this substance released in the body as a reaction to this substance. This usually does not happen, but some substances are causing this certain unexpected reactions to a certain usual like food or materials, all these examples, okay? And based on this sensitivity, there will be some complications like respiratory distress as he presented, swelling of lips, some skin rash, and you are going to praise her. You are going to praise her. You are going to tell her that that was very helpful that you brought him directly to the ER. You are a keen mother. actually you saved his life, and that reflects how good you are. And you are going to tell her about what you offered. You gave her adrenaline, IM, and that will expect to help to control these substance release, and that will help to decrease the side effects. And you told her why he's having this difficulty of breathing, because this substance causes narrowing of the airway tubes, and with giving the antidote or the drug we give, adrenaline, that expected to revert the action and cause more of dilation of the tubes, and help also to decrease the release of these substances. Okay. And in such case, you have to tell her about the other possible side effects which may happen, and you have to tell her about that we should, okay, refer the baby to the allergy department, where they can do skin break test. This is a certain test, usually we check the sensitivity of the baby to certain substances, and based on that we are going to instruct you what to avoid. Okay. And in such case, if he had similar manifestation after exposure to certain substance, we have to tell that we are going to provide her with what's called EpiPen, which is a pen with a needle, and the substance inside is similar to the substance we give her we give Mahmoud in ER, which is adrenaline. That will help to control these manifestations. And you are going to give her a hint how can we inject this. It will be IM, so in the thigh, vertically to be inserted, and it's one time usage. And you are going to tell her for more instructions how to use and how to keep, and how you are going to be supplied if you use this EpiPen. So you are going to direct her to the allergy nurse, where they are going to instruct her about the usage of EpiPen. And the importance in case that she does not have this EpiPen or already used twice. Usually they provide the kit with 2 EpiPens, so she has to go directly to the ER for observation of the vital signs. And you are going to tell her that also, as Mahmoud, he's in school, so they have to be aware about what happened, especially the school nurse, and we have to tell them about his allergy to certain substance in case anything happen. And also we can offer bracelet in which indicates that he's allergic to these substances. Okay. And then you are going to provide her with some leaflets and some websites, and also you arrange appointment with the allergy department, as I mentioned, and you thank her for her listening and her attendance and discharge. There is missing thing maybe I didn't focus on, and we should actually do, that you have to check her understanding in each piece of information you are going to give to her. So in information giving and education, checking of understanding is mandatory. So are you with me? Shall I proceed? So can you tell me, even it's very important here, after you finish this, you have to ask her to repeat what you have mentioned and check her understanding. Okay, you will have time, don't worry about time. If you follow these steps, I think that by the end of your information giving, you will have about 2.5 minutes remaining, in which you can ask her to repeat what you have just said. And as I mentioned, you will thank her after. So whether usually you summarize in Breaking Bad News, it's difficult to ask the mother, for example, to repeat what you have mentioned, because usually in Breaking Bad News, you are not expecting mother to be in a good mood to understand. Usually in a Breaking Bad News, you are not giving too much information. So in information giving, it's different. The environment is different, and baby usually is in a well-controlled environment, and you are expecting her to understand. And let's say that she showed like she's not aware about what you have mentioned, or still she needs more data, so you can arrange another appointment later on. That was an example. What we have mentioned, we can apply on constipation, we can apply on diarrhea, we can apply on any similar scenario for information giving. And as we noticed, we have to be aware about NICE guidelines, especially for station of information giving. And if we are going to revise back what we have mentioned, so in this sequence, you are going to greet her, you are going to introduce yourself, you are going to check her background about the history, what happened, okay, and about the disease itself, if she's understanding why that happened. And based on her knowledge, you are going to build up your introduction and your knowledge. And as I mentioned, in between, you are going to check her understanding for each piece of information you are giving her. You have to avoid jargons in information giving. Okay, so it's very important to avoid jargons in information giving. You have to give very simplified, concise data. Okay, you have to, if there is any referral to different subspecialties, you have to refer. Okay, if the son is in school, you have to involve the school nurse. Okay, if there is any indicator or bracelet we can use, like allergy, or a patient who's having diabetes, or a patient of cystic fibrosis, patient of hemophilia. So bracelet is very important, especially information giving, to think about it and to mention it. And you have to supply her with some leaflets, websites. Okay, if there is anything you can illustrate, like EpiPen, and you can direct her to allergy nurse for more details about EpiPen. And finally, as I mentioned, you are going to ask her to summarize what you have mentioned, and then finally you are going to thank her for her attendance and ask her not to hesitate to contact you if she has any inquiries, and you can arrange another appointment if she wants, and arrange appointment with the allergy department. I think that was a good example for information giving. For education, there are a lot of differences, and also there are a lot of common points between both of them. Education, so the role player will be different, and you can understand that from the scenario, that the role player will be whether a colleague or somebody who's junior staff, or intern, for example. And it will be purely about medical subjects which you are expected to know. So it will be about basics. Let's say that you are going to be asked about ABG interpretation, for example, for intern who attended a patient of diabetes mellitus type 1 in diabetic ketoacidosis, and he notes that blood gas was the figures still he's stuck to his mind, 6.85 or something like that, and he starts to discuss with you about these figures. He does not understand why we were panicked when we did the blood gas in ER for one patient, and we found these figures, and he wants to ask about what are the normal ranges and what is the metabolic acidosis and how we can treat and what are the causes and all this stuff. I think it's not the proper time in this lecture to talk about ABG interpretation, because all of us, we know very well, but we are going to simplify. We are going to divide this topic in main lines and then some lines over each title. So let's say the first and the most important thing to check in this scenario is to be interactive, okay, and to check their knowledge. And usually in education you are expected to listen very well to them, and if you are going to give them information, don't think that because of its education you have to speak more than you listen. Actually, the good thing that you do, that you have to be more interactive. It has to be like you listen to them and check the missing points, and you are going to correct, because you are speaking to those people, medical staff or colleague or whatever. Already they have background, okay, so they need some minute adjustment for their knowledge and how that knowledge can be applied in our practical field. So you greet them, and in introduction, be cautious, because sometimes the scenario is about a colleague or a junior resident who's in R1, for example, and you are a specialist in the unit. So you are expected to know him, okay? So in the introduction, it's not wise to say, okay, I'm Dr. Ahmed, one of the team of pediatrics working here in the ward or something like that, because he is expected to know very well. So you can be like more wise and say, good morning, I know that you are active, doing very good job in pediatrics, and I think you know me, I'm Dr. Ahmed, we have met before. And then you are expecting him to say, yeah, I know you very well. And then you can just try to trigger him, and you can say, I know that in the last time we were in ER, you were interested to the case we were managing, that was diabetes mellitus case. And I think you want to ask me about that case. Do you have any questions? And or you can let him ask. So he's going to tell you that I know that the first thing you did after the patient arrived, you asked for the blood gas, and I still remember the figures, it was 6 point something, and I wonder, because as I remember, this is outside the range, it was very low pH, and you can then start your lecture by asking, do you know what is the normal range? He will say like 7.35 to 7.45. And what do you know about PCO2 level? And what do you know about bicarb level? Do you know what is metabolic acidosis? Do you know what's respiratory alkalosis? Do you know? And then you will ask about the causes, and you will ask about how can we treat the different types of this acid-base disturbances based on the etiology. And you, as I mentioned, it's more of something real in our life. It has to be interactive. You have to check the knowledge, very important, check the knowledge, and to be interactive, to be like brainstorming. So you just give them key, and you are expected to listen to them and let it be like bidirectional, not unidirectional. And then you can encourage them to prepare a slide presentation, or you can encourage them to read certain books, or you can direct them to certain websites, and you can ask them for any educational activities And you can also thank them for asking, not hesitating to ask you, and you will welcome that you are ready to receive any questions later on. And as I mentioned, you have to be more sociable with them. They are working with you in the same field, and it has to be something you are going to, or have to encourage them later on to ask you at any time. So be more familiar to them, and as I mentioned, thank them. I think it will be easy. But the difficulty, the real difficulty, because I know that most of us will think about what is the difficult part in education. I think all other things, if straightforward, will not be difficult. But the difficulty, if the topic you are not sure about your data, okay, and it happened actually. We are practicing pediatrics, maybe we are practicing a certain subspecialty away from a different subspecialty. And for preparation for the MRCPCH exam, the clinical part, as I mentioned, you are not expected to study the whole curriculum of pediatrics. So there will be always possibility that you have a question, you are not sure or precise about the answer. So in such way, you have to be more intelligent, and you have to be clever enough to skip this trick by certain methods. For example, if the subject you don't know about, so you will say, okay, tell me, they will have like brief background about that subject. Then you can say frankly, to be frank, still I don't have fresh data about this information. It was a long time back when I reviewed it last time. I'm not sure about what is the trend now in management of this disease, for example. But actually that was very encouraging from you, that you ask me. Now I will go and read, and I am expecting you to go and read, and we can review this subject together. And really I'm feeling grateful that you are going to encourage me to read again about this subject. I think I have to update my knowledge, and in such way the examiner will have very good impression about you, because you are expected to be in real life in similar scenario. And in such case, as I mentioned, they are checking if you are safe on patients. So if you started faking information, or say, I think, I'm not sure, maybe, which is not allowed at all in the exam, then the impression of the examiner will be very bad. So in such way, you are expected to direct them to the sources. You thank them that they actually they raised this issue with you, and that will be helpful for us together. That will trigger us to search about that disease or that information, and you are going to ask them to prepare and to study, and you yourself are going to study, and we will gather together. You can present that subject, and then all of us will get benefit from this presentation. In real life, you are not expected to know everything. There will be some subjects you are not fully aware about, and that will be a very good chance for them also to take you as model, not to fake information. It's very important. If you try to fake any information, okay, be sure that you are not going to pass this station. But if you mentioned frankly that maybe I'm not aware about that subject, still I have out-of-date data, and I don't like to give you out-of-date data, so it's better to update this data together by reviewing this topic in internet. Okay, really, I know some colleagues, some candidates who passed this station and got clear pass, in spite that they don't have data about that, and specifically the scenario was about the scopolamine batch or hyoscine batch, and they were expected to know about it, but someone, he was frank enough to say and honest enough to say, I don't know, but that will be a good idea to go and read about it, and then we can sit together and share information. So that's all for today. I hope that in this lecture we discussed information giving and education, and I will be happy when I see your feedbacks. Please be more interactive. I'm expecting more feedbacks, and based on your feedbacks we are going to continue. Thank you for listening, and in the next recording we are going to resume talking about the rest of remaining communication scenarios. Thank you and goodbye.